Hello, my name is Alina, and I'm going to be teaching you a little bit about cirrhosis of the liver today. So, as you can see, this is a picture of a guy who has cirrhosis. What is cirrhosis? It's an irreversible inflammatory fibrotic liver disease. So basically the damage that is done cannot be undone. It's a leading cause of death in the United States, and it develops slowly over the years, but its severity and rate of progression depend on the cause. So some of the most common causes include idiopathic, meaning the cause is unknown, hepatitis B and C, and excessive alcohol intake. So basically how it develops is that you have structural changes from your injury and fibrosis, which therefore cirrhosis is a consequence of the infiltration of leukocytes, release of inflammatory mediators, and activation of fibrogenic fibroblasts. So basically all of the fibrosis that's happening causes your biliary channels to become obstructed, and therefore blood flow is limited, which leads to the yellowing of your skin as well as portal hypertension. So new vascular channels will then go into forming shunts. And a shunt is basically, will take the blood and cause it to bypass the liver. So then when the blood bypasses the liver, you end up with things such as portal hypertension, metabolic alterations, and toxin accumulation, since one of the functions of the liver is to detoxify the blood. So if the blood is bypassing the liver, then it's not detoxified, and therefore all of the toxins will accumulate. So instead of regeneration, we then experience things such as hypoxia, necrosis, atrophy, and ultimately liver failure. What does it look like? Basically, the parenchyma of the liver becomes distorted, and the liver has a cobblestone-like appearance, as you can see. The liver may be larger or smaller than normal, and is usually firm or hard when it's palpated. Alcoholic cirrhosis is one of the kinds of cirrhosis, and the other is biliary. Right now we're going to look at alcoholic, which alcoholic is caused by what it sounds like it would be caused by: toxic effects of alcohol metabolism on the liver, and other things such as immunologic alterations, etc., as you can see listed here. Clinical manifestations of alcoholic cirrhosis include an enlargement of the liver or the spleen, ascites, which we covered in class, GI hemorrhage, portal hypertension, hepatic encephalopathy, which occurs when the toxins from the liver actually end up affecting the nerves of the brain, esophageal varices, and anemia from blood loss, malnutrition, and hypersplenism. Evaluation and treatment of alcoholic cirrhosis include that the liver function tests will be abnormal. You will see an increased amount of serum enzymes and bilirubin and decreased levels of serum albumin, as well as a prolonged prothrombin time. Liver biopsy can be used to determine if someone has alcoholic cirrhosis, but if you see any of these clinical manifestations right here, then it's not necessary to do so. This is a liver biopsy of alcoholic cirrhosis. There is no specific treatment, however, so we focus on things such as rest, vitamin supplements, nutritious diet, management of complications, etc. And key fact here is that it's entirely essential to stop drinking, because once you stop drinking, that can prevent the alcoholic cirrhosis from occurring anymore. But as I said, it is a disease to which the damage that is done cannot be undone. Biliary cirrhosis, on the other hand, is damage and inflammation that begins in the bile canaliculi and the bile ducts. So there's two different kinds of biliary cirrhosis. The first one is primary, which is caused by autoimmune T lymphocyte and antibody-mediated destruction of the small bile ducts within the liver. This affects middle-aged women and is also associated with inflammatory bowel disease. So the signs and symptoms you could have, you could start with just having things such as itching, or even hyperbilirubinemia, or yellowing of the skin, or maybe your stool samples may be even light or clay-colored, which then could progress into severe cirrhosis, portal hypertension, and encephalopathy. So life expectancy after you're diagnosed with primary biliary cirrhosis would be 5 to 10 years, and it can be detected by evidence of cholestatic liver disease, including AMA and alkaline phosphatase increased levels, and you can also do an ultrasound or a biopsy of the liver, and it is treated with ursodeoxycholic acid. Secondary biliary cirrhosis is caused by prolonged partial or complete obstruction of the common bile duct or branches, and this is caused by gallstones, tumors, fibrotic structures, or chronic pancreatitis. In children, by biliary atresia and cystic fibrosis. Necrotic areas will develop and lead to proliferation and inflammation of the portal ducts, which leads to edema and fibrosis, and treatment would be surgery to relieve the obstruction or diminish and resolve the symptoms. These are my references, and thank you very much. Have a great rest of your day.